neurophysiology researcher. Dr. Rajajeyakumar published 125 research papers, H index 12, I-10 index 50, 800 plus citations. He delivered invited lectures in USA, UK, Canada, Dubai, Sri Lanka, Thailand, Singapore, and many more countries. Sir is also an editorial board member and reviewer in 45 plus international journals. Recipient of 22 prestigious awards, he supervised over 100 UG or PG student research projects and 5 ICMR STS grants. So, without any further ado, please join me in welcoming Dr. Rajajeyakumar, sir. Over to you, sir.
This is a very good evening. So, is audible to everyone? Am I audible to everyone? Is clear?
Yes, sir. Yes, sir. Yes, sir.
Okay, fine. So first of all, I have to thank the organizing committee member of our students. Community is organizing this good webinar for international level. So thanks to everyone. Before going to start the session, so I need to check that my volume and I'm going to share my PowerPoint. Whether it's visible to everyone, kindly check it before going to start my session. Okay. Can I share my PowerPoint?
Yes, sir. You may share.
Yeah, fine. Hi, is visible to everyone?
Yes, sir. It's visible.
Okay, fine. Good. So kindly check that my PowerPoint is moving.
Yes, sir. It's perfect.
Perfect. So audio is clear, visual is clear. So before going to start my session, then I have to confirm everything. Okay, if you have any issue, please inform me in the chat box. So which is going to helpful for me to stop and check it again. Fine. Okay. So good evening to one and all. This is today's auspicious occasion. We have celebrating 3 important days. So one is Onam, then Miladi Nabi, and one more is Teachers Day. So I wish you all regarding this auspicious day. We are conducting one international webinar regarding this very important topic, but mostly is underrated. So that's why we taken this topic regarding for discussion. The topic is autonomic dysregulation in the modern era. So early neurophysiological diagnostic and preventive intervention, how is going to helpful for them to identify the screening and both preventive and diagnostic aspect we are going to discuss today. Okay, fine. Okay, but we are going to give you external stimulus, whether the person is going to respond that particular stimulus. For example, we are going to change the position, lying to standing, or we can ask the person to merge the hand into cold water, hand grip against the resistance, valsalva maneuver. These are the reactivity tests. We are going to give one stimulus, how the autonomic nervous system is going to work on that. Second test is activity test. So activity means we are not going to disturb the particular subject. Okay, but at rest, we are going to measure the component that is known as activity test. Example, recording of resting heart rate, blood pressure, and heart rate variability. And resting heart rate, I already told that is a parasympathetic function. Resting BP is a sympathetic test. Okay, come to this picture. You can see this is a conventional autonomic function test when I was in GYPMER. So you can be able to see this one. This is a polygraph. This is a big machine. I think so. The cursor is. Are you able to see my cursor? Yes or no?
Yes, sir.
No.
Yes, sir.
Yeah. So this is the old type of polygraph. This poly means many, graph means recording. So we are going to record many parameter at a time. So ECG, respiration, pulse, temperature, then JVP. So many things we can able to record it at a time. So that's why it's known as polygraph. Okay, fine. So this is an old one. Then we have replaced. This is the new one. I think so. You can able to see this is a new one. So this is a new one. Mostly we can take it from biobank. So here what we can have the sensor. This attachment to the sensor. So we can easily use the main hardware. recording is going on online, so we can live recording is going on. That time we can easily find out whether the person having giddiness or not by seeing this RR interval. This RR interval is shortened means tachycardia. With the person in tachycardia, if the RR is mostly broadened, then the person is going for syncope, bradycardia. So that's we can easily find out by RR interval and the recording ECG. So the whole type of tilt table test. Okay. Now you can see this. We made the patient. We are recording. This is a respiratory sensor in the abdomen. We already record tie with this ECG. Yeah. Then you can see this recording is going on. This is ECG recording, the green color. Then above that, you can see this sine wave pattern. That is respiration. So upward deflection is inspiration, downward is expiration. During inspiration, what is the RR interval? During expiration is what is the RR interval? That is known as EA ratio. Expiration, inspiration ratio, we can take it. You can come to this side, you can see this very clearly, the screen. You have two type of ECG recording here. One is red color, another one is green color. Then in between, you can see the sine wave pattern. So red wave is raw ECG without filter. The green one is with filter. Then you can see this respiratory movement. I already told upward inspiration, downward expiration. Then parallelly you can check it. What is the duration of RR interval during inspiration? What is the duration of RR interval during expiration? Then you can make it EA ratio. This respiration is deep breathing. We are going to make it deep breathing means 6 cycle per minute. So 6 cycle means the person having 6 cycle means each cycle consists of 10 seconds. So 5 seconds for inspiration, 5 seconds for expiration. So each cycle consists of 10 seconds. So 6 cycle means 6 into 10, 60 seconds, 1 minute. So we are going to make it 1 minute deep breathing test. In the meantime, we are going to record RR interval. Then we can easily calculate EA ratio. Then whether it is normal or abnormal, then which is going to help to pass. So this is a student, she is performing deep breathing test. So I'm giving instruction. Then she's performing. So the meantime, that another technician is taking the blood pressure. ECG is recorded during the maneuver. So I already told that head up tilt test, which is going to be helpful for orthostatic hypotension. We can easily find out by using the tilt table test. Okay, whether it's due to neurological or the syncope due to neurological or cardiovascular problem. So we can easily find out whether person having dysautonomia, neurogenic syncope, or orthostatic hypotension, or postural orthostatic tachycardia syndrome. So we can differentiate these kind of autonomic dysfunction by using tilt table test. Okay, come to the final one. This is, I told you, the advanced 5 to 10 minutes recording of autonomic function, which is going to reflect the person whether it's more sympathetic or parasympathetic. Also, we can easily find out the personality, whether the person is hyperactive or lethargic, even though we can easily find out by psychological aspect. So what is mean that heart rate variability? The name itself we can easily identify the beat to beat variation of heart rate. That is known as heart rate variability. You can see this RR interval.
Offered us valuable perspectives, and I truly appreciate the time and expertise you shared with us. Lastly, a heartfelt thank you as well to our enthusiastic audience for your active participation and engagement throughout the session.
The final
So,
conclude message I will give it to you because today is my teacher's day, so I need to introduce my teacher. So I given
yeah,
the photo, but we rapidly start in the session. This is my teacher. Is Dr. Madan Mogan. That time I was in Jipmer. He is HOD. He was the HOD. So he's a very good teacher. Based on him only, we have developed this kind of this level. So I'm very much thankful for him to this session because it's a very important forum to thank our teacher. It's a teacher's day, so that's why we need to give the credit to our teachers. So I'm very happy to share with him. Then one more thing, I need to give this thanks to our Savita University, Savita Medical College for this wonderful opportunity they are providing me to full freedom to give all kind of session. So particularly I have to thank our director, Dr. Deepak. So it's like this only we are going to give this long running of this kind of sessions. So thank you, everyone. Thanks to you all.
Thank you, sir, for giving us this insightful session on the day of Teachers' Day. We are also very grateful to have such knowledgeable people around us, and we are grateful to gather knowledge from you guys. So, so for the audience, I'd say please complete the feedback form. I'll